Scientists discover how peppermint soothes gastric pain. Not necessarily true, Pressman says. It goes this way. Peppermint helps relieve the symptoms of irritable bowel syndrome. Yes, as it does. It's not gastric pain. Gastric pain is stomach pain. Big difference. It says peppermint activates an anti-pain channel in the colon. That's true. This contributes to the relief of pain from inflammation in the gastrointestinal tract. It is true. Peppermint acts through a specific anti-pain channel to reduce pain-sensing fibers in your intestinal tract. However, keep in mind, peppermint can lead to stomach irritation. Peppermint has the ability, and this is crucial to remember, to literally relax the sphincter between the esophagus and the stomach. Now, if you've got gastroesophageal reflux, GERD, indigestion, that sphincter is already too relaxed. It's already relaxed too much. You do not want to add to that relaxation of that sphincter. It's going to increase dramatically that gastroesophageal reflux. If you've got a gallbladder issue, peppermint will relax the gallbladder sphincter, possibly setting up the passage of a gallstone into your intestinal tract. It is not good. By relaxing the muscles that hold the sphincter closed in both cases, you can lead to gastritis, burning, inflammation, gastritis, reflux disease, gallbladder disease. So peppermint is not particularly good for your stomach. It's great for your intestinal tract. It's wonderful for your intestinal tract. So if you're going to take it in an encoded format, as an enteric coating if you need to. But if you've got any kind of stomach problem, I want you to avoid it. I'm going to tell you a story that points this out. A new patient of mine, I don't know, about 2 or 3 weeks ago, was told by his doctor, because he had inflammation of the stomach, to eat ice cream. He said ice cream is going to be good because it'll coat your stomach, it'll make you feel better. I mean, that's possibly true, but there are a lot better things that he could be doing than ice cream. So I didn't like that advice to begin with. But what he found was the more ice cream he did, the worse he felt, the more indigestion he felt. And his doctor said, well, it's in your mind, it can't be. And I said, well, tell me about your ice cream. How much were you eating? He said, oh, about a pint a day. That's a lot. And I said, what kind of ice cream was it? And he said, peppermint. Oh my gosh, that's exactly the opposite of what you want to do. Peppermint is not good for people with reflux disease, for indigestion, people that have gallbladder issues. Peppermint's interesting. Look, there's some studies that show that the aroma of peppermint is good for your memory. Peppermint is no doubt good for your intestinal tract, but it can be a real problem for your stomach. So keep that in mind. Next time you're going to reach for some kind of peppermint mint or candy if you've got a stomach problem. Not particularly good. By the way, as a general aside, peppermint can interfere with blood pressure medications, what we call calcium channel blockers, like Procardia, Cardine, Verapamil, Norvasc, and over 20 other calcium channel blocker blood pressure meds can be interfered with by taking peppermint or peppermint oil. So there you go, a word of caution about peppermint.